welcome back. Today we're going to talk about a subject that's on everybody's mind and that's everywhere all at once, trauma. We're also going to talk about trauma-informed therapy and also what is trauma? So first off, I want to make it clear that trauma is not you. Trauma is what happens to you when you go through an experience that creates a sensation in your brain of fear, fight, flight, or fawning. So like these kinds of activities happen in your brain when you're traumatized. There are events in our lives that are traumatizing. They can involve violence. They can involve witnessing violence. They can involve causing violence, and they also can just involve the vicarious trauma that we experience being sensitive human beings and hearing other people's stories or reading about what's on the news today. There is so much negative news that it's hard to get away from what's traumatizing. And then what happens to you when you experience and take in all of this information? It will change your brain chemistry. It will change your body chemistry, and it'll totally affect your day and how you're living. So then I want to emphasize that it's important to realize that trauma is not you. Trauma is what's happening inside of you. So how do we make progress in this world of trauma and drama and pain and suffering? How do we get through this? Well, lately, maybe you've been reading about trauma-informed therapy. So people say you should see a therapist who's trauma-informed. What does that mean? Typically, it means somebody who's had some specific training in what trauma does to your physiology. Trauma, when it's experienced, creates an increase in cortisol. Cortisol is a stress hormone. This stress hormone, cortisol, it affects your brain. It makes your brain stop thinking. It makes your brain freeze. It makes your brain surge into fight, or it makes your brain say, oh, I've got to please you. How are you? It goes into fawn. So you're not actually being true. You're having a traumatic response. So a trauma-informed therapist is going to know this and help you to peel back the layers of how trauma is infecting you. And I said the word infecting because it does infect us. So trauma-informed therapists know about the cortisol system. They also know and are sensitive to situations in a person's life where people are under stress and aren't able to be themselves. They also recognize situations which can create pain and suffering. So in other words, you're not just this static being who's experiencing depression or anxiety or dissociation. You are a person who's participating in your environment, and your environment is participating with you. So are you in a traumatizing environment? Do you have recurrent traumatizing repetitive thoughts? Are you in a traumatic relationship? A trauma-informed therapist can help you piece together these ideas while understanding your physiology and help you to get a map back to who you are. So this is a really important concept. You are not trauma. Trauma is what happens to you. So, who are you? By the way, if you're liking what you see, please continue to watch and don't forget to hit the like and the subscribe button and leave a few comments if you're interested. So, what I'd like to talk about is what are you? What are you, the part of you that gets affected during trauma? So that's a really important kernel of understanding we all need in order to fully function in the world, because it's very easy to get off course. It's very easy to lose sight of who you are when you're surrounded by news of war, financial crisis, grades, inflation, or just seeing an animal in pain on the side of the road. So the thing is, who am I in the midst of experiencing this pain? Well, we learn who we are when we disconnect from the trauma. There are ways we can do that. And there are a few simple ways. One is that we breathe. It's really cheap. It's really easy, and it's super easy to forget. When we are in this heightened state, one of the best things we can do to restore our physiology is to breathe, and it feels really good. Then you start bringing yourself back in your body. I'm rubbing my hands. That's one way. Just come back into your body so all your energy isn't all out there. It comes back in here. And you ground yourself and you say, I am not this tragedy. This tragedy is happening around me. I am not this trauma. And you pause and you remember, well, I was on my way to work today and I was excited to see what was going to happen for the day. You remind yourself of the moment. You remind yourself you are okay and you're going to survive. So those are some very basic things. Now, obviously, if you have severe PTSD and dissociation, that's a whole different video, and that involves a lot of work. But just in our day-to-day traumatic world, how does one get by? I'd also like to talk about how trauma affects us chronically. It's really important to get a handle on that and to understand that it's going to affect your mood if you've been reading a lot of depressing information on the internet. It's going to affect your mood if you've watched a lot of angry political content. It's going to affect your mood if you have gotten into a fight with somebody at the grocery store. Okay, so let's say that's a traumatic event. It's not enough to cause PTSD, but these things build up over time. And over time, it will affect your mood and it will affect your physiology. So it's important to recognize that over time, this buildup can cause stomach issues, insomnia, headaches, fatigue, body pain, trouble in relationships, eventually panic attacks and generalized anxiety. So habits that we develop, I'd say throughout the day, prevent us from getting this buildup of traumatic events that can create a longer lasting problem. So again, when one notices that they haven't been breathing or that they're clenched or that something took them away from the moment, ask yourself, I think I'm kind of experiencing a traumatic feeling, and take a second to breathe, to get back in your body, and just to remember or bring yourself back to who you are. Another important thing in this world where there's so much trauma and pain, I think it's important to remember, how do I keep my heart open? How do I stay being a sensitive person? Because it's really difficult to stay really sensitive and engaged when bombarded by chronic negative thinking, by stress and drama, and, I'm going to say our trauma-saturated culture. I think you can get some relief, your heart can get some relief just by doing those three things kind of a couple of times a day. Make it a habit to check in with yourself. Now, there are other things you can do to take it to another level. For example, You could journal every day at the end of the day or the beginning of the day. You could take a walk because the outside air, the sun, and the movement of our bodies helps us to discharge tension and stress and pain that we've held inside. It's remarkable, and it's very simple. You could also spend time with a beloved pet because the relationship is very healing and it doesn't involve too much words. It doesn't involve thinking. And it's a very loving thing you can do for yourself. And at the end of the day, to bring yourself back from all of the pain and all of the suffering, you can remember that there are other things going on in the world besides all of the pain and all of the suffering. So let's go back to the beginning. We wanted to talk today about trauma, trauma-informed therapy, and what trauma does to our bodies and our brains, and also how to work with it, how to keep our hearts open. I hope you learned something, and thank you so much for watching. Bye.